Okay, well, we're about to get started, but I welcome everybody. I'm Amy Haddad. I'm the Director of Public Policy and Government Affairs for MCHB. Here are some of the housekeeping instructions. So everyone's muted. If you want to be unmuted, raise a hand, or you can also use the chat box to chat either all attendees or just one of the panelists. Jess Cohen would be your best bet for any technical questions related to the webinar. And with that, I'm going to turn it over to Jonathan Webb.
Thanks, Amy. Welcome, everyone. Thank you for joining today's call. I'd like to offer virtual high fives to you all, as is my typical style, just to thank you all for your leadership, your dedication, and your support of the communities and constituents you're serving in this new COVID-19 normal. So thank you all for your efforts, your advocacy, and your hard work on the ground. My thoughts and prayers are with you and your families, as well as those healthcare workers who are sacrificing so much on the front lines to make sure that we are all safe and healthy. Today's call, I'll be very brief in my comments because we want to allow more time for our partners from the CDC and partners from the Maternal and Child Health Bureau to talk. But more importantly, we want to allow enough time to hear back from you, the states and territory leaders and families and representatives on the phone today to hear more from what your needs may be. Just as a little bit of a background, this call came into being because we were hearing from many of our members about some of the needs and opportunities that were being presented on the ground. And we as a membership organization wanted to be responsive and also try to be a little bit proactive in engaging you in sharing information and receiving information from you. So a couple of things that you'll have hopefully noticed over the last couple of weeks is that on our website, we have a section on MCHB.org that has a collection of maternal and child health friendly resources. We've been collecting these resources over the last week or so, and we are anxiously looking for more resources to share. So please take the opportunity to go on that website and see what's there. But if you see something that's missing that either you produce or you've seen available, please share it with us, and we'll make sure it gets there for dissemination to your colleagues. Secondly, we are trying to be respectful of your time by not adding new items on your calendar. So we were able to repurpose Amy's regular policy call for the purpose today of this town hall. We're looking to have this town hall occur bi-weekly to provide an opportunity for us to share information with you, but as I mentioned earlier, more importantly, to hear from you. There are things that are happening on the ground that we need to be aware of, that we want to share with our federal agency partners, and want to have a real dialogue around that and be able to respond as quickly as possible. So in that spirit today, Amy's going to lead us off with a very brief overview of some of the things coming down from a policy perspective, to give us an overview of some of the new information coming out of the stimulus package. We expect there will be many more packages to come, but Amy's going to help us to decipher what's out there now and has just hit the street. And then we'll also be followed by brief presentations from our CDC colleagues. We have Dr. Regina Peacock on the phone from the At-Risk Task Force. We have Dr. Romeo Galang from the clinical team for medical care and countermeasures. And they'll be followed by Dr. Michael Warren, who, as you know, is the Associate Administrator of HRSA's Maternal and Child Health Bureau. So I will step out of the way, again, look for an opportunity for us to really engage in a meaningful dialogue in terms of what is coming out that is beneficial to you, but also those things that we're not yet aware of that you can share real time with us and hopefully game plan around with you. So with that, I'll stop and let Amy proceed.
Great, and we were just made aware that there's been an issue where the Zoom platform wasn't letting certain people in. So we're figuring out how to do that right now, and it's being done, but this is being recorded. So if in the meantime, if you know anybody who is having trouble getting in, we promise to distribute to everyone who's registered, but everyone should be able to be able to join us with hopefully the next few minutes. So again, quickly, the agenda, Jonathan Webb, our CEO, just provided the welcome. I'll do this legislative update. We'll turn it over to our CDC and MCHB folks, and then we'll have plenty of time for that state sharing. So as you know, Congress has already passed 3 packages to address COVID-19. They're now being affectionately known as COVID 1, 2, 3. They're already starting to work on 4. The latest one, which was the CARES Act, just became law on Friday, March 27th, but it started actually with the first package that provided $8.3 billion in emergency funding, which included $1.6 billion for international response and $6.7 billion for domestic response. I will say, in an effort, again, to give as much time as possible to dialogue, all the slides will be emailed to you, as well as some additional resources with summaries and good resources about what's in all these packages. So the first one, funding that went directly out to a number of federal agencies, including plenty, obviously, for our health partners. And then the second one was named Families First, really started to get at how we can address the needs of individuals. So emergency paid sick leave, emergency paid family leave, and unemployment benefits. There, again, will be a resource mailed to you with a lot more detail about the paid leave and family leave, the sick leave benefits that were included in those bills, but it also included free coronavirus testing, expanded food assistance through programs like WIC and food banks, requires employers to provide additional protections for healthcare workers. I'm sure that's something you've heard about either anecdotally from friends and neighbors or in the news. And then really importantly, an emergency 6.2% increase to FMAP. That's the matching rate that states get for Medicaid. We know there's going to be increased need with, the rise in unemployment, people who are going to need access to Medicaid, additional costs incurred by Medicaid. So there's the extra federal help for states to be able to provide that. And then the third package, the CARES Act, as it's known, this includes a couple of highlights that I'll share right now. $150 billion to states for expenditures incurred responding to the coronavirus outbreak. We know that states' budgets are going to be hit hard by this in a myriad of ways. So this lasts through the end of the year and can be retroactive to March 1st. It's being disseminated first. Every state is guaranteed at least $1.25 billion, but then the remainder is determined by population. There is a tribal set aside of $8 billion, very important. As well, and then localities with more than 500,000 people can apply directly to get some of our largest metropolitan areas. There's $150 billion for health system equipment and infrastructure, responding to a lot of the needs that we've heard from health providers, hospitals, the direct payments to families. So again, in your resources that you'll receive, it explains how that phases out. I think it eventually phases out for families just under $200,000 in income, but those are starting to go out very soon. But there's, it's like a sliding scale for how much each family will receive. A lot of student loan relief in here, influx of cash for community health centers as well. And then there's other types of emergency support for schools, for childcare, transit, aviation, housing, a number of industries. They've all been hit hard by this, of course. Those of us with children especially know what the childcare situation is right now. So that's really what these programs were aiming to do in the immediate relief. The next package they're talking about seems to be focused on more longer term recovery. But starting with infrastructure, and I can assure you that MCHB, as we work with our partners in the community, are making sure that public health infrastructure is at the table as well. A lot of times when folks talk about infrastructure, they're talking about things like transportation, but we're making sure that public health infrastructure is part of this as well. And then just because of our audience today, I thought it was important to point out some of the extra provisions that got included, I think, because Congress needed to get these done and saw a moving vehicle, but things like Healthy Start program reauthorized, Title VII and Title VIII, which are health professions and nurse loan repayment programs, and the extension of PrEP and sexual risk avoidance education, which used to be called abstinence-only education. Those have been, the last bullet programs have been extended through November 30th, just to make sure that they didn't get left behind. So that's just obviously a very quick highlight. I'm happy to take questions later or just email me anytime, because I'm sure you'll really want to hear from our esteemed federal partners today. But that's just to give you a quick overview of the first 3 packages that have passed. And then the 4th one is being worked on immediately. And like I said, we welcome knowing, are there things, obviously funding, but if there are policy challenges, anything that you might need a little extra flexibility in that might need to be done legislatively, that's something that MCHB would be interested in hearing about so that we can understand better what your needs are for our members in the states. And with that, I'm going to turn it over to Dr. Galang.
Thank you. Can you hear me?
Mm-hmm.
Excellent. Well, thank you, everybody, and thank you for the invitation to join you all. I will be fairly brief. What I'll do is give an overview of where I sit at CDC, which is on our clinical team on the Medical Care and Countermeasures Task Force, and to talk a little bit more about our activities. So the task force itself, as far as how we work, we generally do activities that address concerns related to infection prevention and control, healthcare worker safety, healthcare systems, and related to actual clinical guidance and management that's used by our physicians and healthcare providers out in the field. There are many other task forces as a part of response. As you can imagine, it's quite large, but the ones that we work with the most regularly are the Epidemiology Task Force, whose job is to identify persons with COVID-19 and who it's affecting. And then we also work very closely with the At-Risk Task Force, which Dr. Peacock will describe just after this. In terms of our overall operations on clinical team, we have several functions, and these include reviewing the data, which seems to change every single day, related to COVID-19 and its implications for clinical management and for infection prevention and control. We spend quite a bit of time developing guidance for clinicians in healthcare facilities, and as well as responding to inquiries about guidance and clinical scenarios that we receive through various routes, whether it's through the Emergency Operations Center Watch Desk or through CDC Info, or if there are questions that come to us from other health departments or from our federal partners. Our team is really divided into 3 separate units. The first one is our core clinical unit, which does just about the everyday nitty-gritty of taking a look at the data, trying to understand what would be best to present and what's the most useful information out there for the field. And that's also where a lot of our activity around women and children sit, specifically around obstetrical care and neonatal care. The next group unit within our team is a mortality unit, and this addresses issues related to deaths, unexplained deaths. That's among persons with COVID-19. And so there's quite a bit of work with state medical examiners, talking through consultations on pathology and autopsies and investigation of deaths, including ones that happen within among women and children. And finally, we do have a data collection arm, which is a hospitalization unit that's trying to really understand what's happening with our most critically ill patients in the hospitals themselves. In terms of our current work that's related to maternal and child health, as you know, there's guidance on the CDC webpage for inpatient obstetrical care, particularly around infection prevention and control. That was posted back in February, and we're hoping to have an update for that soon. We also are looking to update a set of FAQs related to that guidance. We are partnering very closely with the At-Risk Task Force in the guidance around the clinical care for neonates. And we are looking very closely at some of the data and some concerns that have been raised out in the media regarding infection control related to between mom and baby and what to do both in the hospital and potentially at home when they leave the hospital. We work closely with our partners in the American College of Obstetrics and Gynecology and the American Academy of Pediatrics regarding the guidance and frequently asked questions that they receive from their constituents. And we do quite a bit of work with our epidemiology team task force on how to best gather data to inform what we do as a whole regarding pregnancy and infants. I'm going to stop there and pass the baton to Dr. Georgina Peacock.
Hi there. Can you all hear me?
We can hear you.
Oh, great. Okay, and I do have some slides, so if Amy, yep, there you go. So you can move on to the, well, actually, I'll start here. So I'm Georgina Peacock. I'm usually the Division Director for Human Development and Disability in the National Center on Birth Defects and Developmental Disabilities. And then for about the past month, I've been leading the at-risk task force in the COVID-19 response. And I'll give you a little bit of information about what we're doing within this task force. Next slide. Whoops, actually, okay, we can stay there. The task force is focused on reducing morbidity and mortality for those who are at greatest risk for severe illness with COVID-19. And so you'll see here we have a list of people who are at higher risk for severe illness. And then we also have other populations that are at risk due to social circumstances or social context. Those include pregnant people, people experiencing homelessness, people with disabilities, minority groups, including racial, ethnic, sexual, and gender. And in conjunction with our CDC communications colleagues, also people who speak English as a second language and people who have low literacy. We also have a social behavioral and emotional wellness team. This team is focused on thinking more long-term about sort of in the short term, but also more long-term about the other things that are happening as a consequence of the pandemic. So not necessarily that the issues around being at severe risk for or high risk for severe illness, but being at risk for poor outcomes of for other reasons or decreased quality of life. And so that social behavioral and emotional wellness group is another really important part of our task force. If you can move on to the next slide. So we do this work by working through partnership and outreach, and also doing a lot of communication through different modes, through the website, through different social media, through doing conversations like this. We also are focused on making sure that the information is reaching people in different ways. You'll see here on the left of the screen, we've released a number of ASL videos, and we know that people are hungry for getting information in different ways. Yesterday, we released a new set of videos and in ASL, and within about 5 hours of them being released on Instagram, we had 42,000 people that had viewed them, and by this morning, 63,000. So we are really trying to think with our communication colleagues about how to reach people. I think for those of you on Facebook, you may be seeing posts quite frequently. We're working with the Ad Council doing PSAs and other things like that. And what we're trying to do, as I said, is reduce morbidity and mortality for those at severe risk for severe illness, as well as addressing those populations that are affected by the pandemic on the social behavioral side of things. Next slide. So as part of our task force, we also focus on maternal child health. And I'm going to talk about some specific things that we've done related to maternal child health, and then I'm going to see if my colleague, Dr. Erin Tromble, is on the phone to add to the context of what's going on there, because she's leading those efforts for us within the task force. So we've been conducting outreach with community partners among maternal child health and breastfeeding advocacy groups. We've been liaising with federal agencies and other professional organizations, like Dr. Galang said, with the AAP and with ACOG. We work very closely with the team that Dr. Galang talked about, developing guidance, including guidance related to breastfeeding, inpatient OB guidance, and there is neonatal guidance that is under development. We also, in preparation, sort of in the early parts of this response, developed a pregnancy supplement to the regular case collecting report form that is specifically there so that data can be gathered around maternal child health outcomes. We've also developed a specimen collection protocol, and that is designed to understand the risk of in utero transmission between mother and baby, as well as through breast milk. And so that's something that we as the task force wouldn't be doing, but we've helped develop that and are working with our colleagues in the lab task force. We also provide consultation to state and local jurisdictions with regard to maternal infant child health. We respond to a lot of public inquiries that are coming in, and we are also exploring ways to integrate into the COVID-19 response the emerging threats to mothers and babies. At this point, if Erin Tromble is available, she may want to add some more information about this.
Hi, this is Erin Tromble. I am here. Thank you, Dr. Peacock. So I am a pediatrician. I'm also general emergency trained, and I've been working on the at-risk task force for a little over a month. And really working closely with Dr. Galang and his peers in the clinical in the clinical team to help support the needs and requests from our partners in developing guidance and information related to risks both for pregnant people as well as babies and children. I think both Dr. Peacock and Dr. Galang have summarized well our work at this point. We really are trying to both support learning more from the information that's becoming available every day, as well as thinking of strategies that we can develop to enhance the information, and then ultimately turning what we learn as COVID-19 continues into communications tools that we can better inform the public so that they can protect themselves and their families as the outbreak develops. So I don't know that I have anything more specific to add related to the specific items, but I'm happy to help address any questions when the time is appropriate.
Thank you so much. At this point, I'm going to ask us to hold any questions, and we'll transition over to Dr. Michael Warren to share what's happening at HRSA's Maternal and Child Health Bureau. And then we'll have questions and comments and the like to follow after Dr. Warren's finished.
Good afternoon. Thank you, Jonathan and Amy and MCHB colleagues, and also thanks to our colleagues at CDC who are working incredibly hard on this. It's good to be with you all, even if it's virtually this afternoon, to connect. I'm also joined virtually by a number of our staff from MCHB and our Division of State and Community Health who manage the Title V block grant, as well as Laura Kavanaugh, our deputy for the Bureau. We want to give you a brief update on what's going on at HRSA, specifically within the Bureau around this, and then leave lots of time to hear from you and your questions. We really appreciate this opportunity not only to share information with you, but more importantly, to hear from you about what you're seeing in your states and your jurisdictions as this response evolves. We have heard from several states who have reached out with concern about being able to complete this year's Title V block grant application and report, which, as you all know, this year also includes the needs assessment. We have explored a range of different accommodations and talked both with our grants management folks as well as the legal folks. And so I'm pleased to share with you, we've decided to introduce some modifications. We're going to be allowing a rolling due date for submission of your block grant application and report. States and jurisdictions will have the option to submit the block grant anytime between July 15th and September 15th. Unlike other years where you've entered in your application and report, and then you have the opportunity to go back in after your face-to-face review, there will only be the one submission this year, and that's, again, between July 15th and September 15th. Before we get into specific details, I want to share with you some key dates, and so if we can advance the slides, we'll walk through those with you. Thank you. So on September 15th, that again is the due date for the block grant application report, which also includes the needs assessment. So rather than have a first round submission and then a opportunity to go back in, there will just be that one due date. Our staff will work very quickly between September 15th and September 30th, which is the end of the fiscal year, to do an abbreviated internal review. And that will just make sure that states are meeting the financial assurances, the 30-30-10 rule, and that all the parts of the application are there. And we will do that really quickly so that on October 1st, when the new fiscal year starts, we can award the FY21 block grants. Then between October 1st and December 31st, we will hold virtual block grant meetings with each of the states and jurisdictions. So in place of the normal reviews that you have in person or in state, these will be virtual. And then between October 1st and then the end of March in 2021, we'll be getting your summary statements out to you. So this approach hopefully offers some flexibility and relief for states that need an extension, while also giving an option for states to submit earlier if they wish. We also, in trying to balance that, have tried to make sure we're compliant with the law, which actually says you have to have an application and a report every year. I want to be sure to allow time for your questions, but I also want to quickly say that I know some of you may be concerned that we're not able to just waive the requirements to submit an application or a report this year. We are trying to be as flexible as we can within the Title V law. And so I want you to hear from me. Please do what you can reasonably accomplish in preparing the needs assessment, the action plan, the block grant application, and the report. Let me repeat that. Please do what you can reasonably accomplish in preparing the needs assessment summary, the action plan, the block grant application, and the report. We have heard from a lot of states who have been working on their needs assessments for a while now, and some of them are almost complete. That said, we also know that some folks still have priority setting meetings that are planned, or there may be Title V program staff who were assigned to work on the needs assessment who are no longer available. We do recognize those difficulties that you are facing. And so again, I will repeat, we encourage you to do what you can reasonably accomplish in preparing the needs assessment, the block grant application report, and your action plan. While all of the components do have to be submitted, you will have the opportunity next year to make updates to the application and annual report, of course, but also to your performance measures, your evidence-based strategy measures, your state performance measures, and outcome measures. If there are pieces of the application and report this year that are incomplete due to COVID-19, including any state and local reporting, we just ask that you provide clarification in a field note. So that's the block grant. As you know, 5 agencies often are involved in administering a number of other discretionary grants that come from the Bureau. And so I wanted to share with you, a number of states administer MCHB through the state Title V agencies or Title V directors are somehow involved. So the MCHB non-competing continuation update application, we recognize, again, this is a challenging time and that the COVID-19 response is impacting home visiting service delivery, both in states and local programs in many ways. And so HRSA is granting an extension for submitting the non-competing continuation update until May 29th at 11:59 p.m. Eastern. And if you've got questions about that, you can reach out to your MCH project officer. At this point, the deadline for other funding opportunities and progress reports remain unchanged. For funding opportunities, we encourage you, if possible, to submit an application prior to the deadline. In case there are challenges in submitting it through the system, we will continue to monitor the situation and assess whether deadlines for NOFOs need to be extended. The good news in MCHB is most of our NOFOs to states were out earlier in the year and have already been submitted. But if your organization is applying for something and is unable to submit the application in a timely manner, you can request an extension of a NOFO published deadline, and instructions for how to do that are in the NOFO. I think I'm just scrolling through. I want to hit the highlights and make sure I give top level remarks to you. Let me just say, as this evolves, we want to hear from you. We want you first and foremost to be safe and healthy on your own and in your teams as you're working to support your states and jurisdictions. There are going to be the parts of this response that are immediate in terms of the clinical and infectious disease related response to COVID. And then there are going to be the additional and probably longer term responses related to the impact on mothers, children, and families. And so please keep us posted as those situations evolve and as you identify emerging needs, not only related to your block grant, but for the MCH population. As this is going, if there are issues about work plans with grants or questions that you have, please reach out to your MCHB project officers regarding possible alternative approaches to your planned activities. And then once the response has waned some, we will work with you on any required activities that you had originally planned to complete. On the next slide, we just share a few links, and these will be shared with you, I think, after the presentation as well. But there are a number of resources we're putting together already, particularly frequently asked questions or FAQs related to grants and programs. You can find those here, but again, if you don't find the answer you're looking for, or if there are new or evolving questions, please reach out to your project officers and let us hear from you. So I want to thank you all again for the important work you're doing every day. I hate that we couldn't see you at the conference in person, but you're doing the most important thing that you could be doing right now, and that's taking care of mothers, children, and families in this country. And we are so grateful that you are doing it. You are absolutely up to the task, and we'll look forward to hearing from you later on this call today and in the weeks and months to come. Thank you.
Thank you, Dr. Warren. And thank you to our MCHB and CDC leads on the call today. I really appreciate the your leadership, your sacrifice, and the information you provided. I know there are a number of questions that we've received, and there's some coming up in the chat box here that have been raised. So I'll kick off a couple. I'll start with you, Dr. Warren, if you don't mind. As you have rolled out your timeline, I know that there have been some questions that we've received from our membership around the potential impact of COVID on the August block grant reviews. Has there been any conversation around that as well, or anything you can share?
So thank you for that question. I'll reiterate with the timeline that I shared on the slides. We will not be doing the August in-person block grant reviews. So again, there will be a rolling deadline for submission of the block grant application and report, which includes the needs assessment summary. So instead of July 15th being the deadline for that, you can submit. TVIS actually opened up this week, and so I always used to wonder, they said states can submit as early as they want. When I was in the state, I was never in a position to submit in April or May. But the system is open and states will be able to submit soon, but anytime between July 15th and September 15th, certainly. September 15th is that cutoff date. We will then, between September 15th and September 30th, conduct internal reviews, just the staff. So staff will basically look over to make sure that the financial assurances are in place and all the components in terms of the application, the report, the needs assessment summary are there, so that we can get awards out by October 1st for the start of the new fiscal year. After that, we'll schedule virtual reviews with the state, so there will not be the August in-person reviews.
Great, thank you. And then to our CDC colleagues, just wanted to flag and didn't know if you wanted to say anything additional about the work of the at-risk team. You highlighted that there were discussions happening around. There was a team focusing on the social and emotional aspects of the COVID response, and we're glad to hear that there is a group looking at that. I will say a number of the conversations that I've been having with our state and territorial members and families have been related to that. So as you are hearing those things and producing resources, can you provide any more guidance on some of the types of tools and resources that may be coming out to support those conversations with respect to the social and emotional aspects of COVID-19?
Sure, this is Georgina. So I think starting first with our website, we have a number of resources that are being posted on there. It's in the section that I think now is called Daily Life and Coping, and we will continue to update that with other information. I know that there is a resource going up there very soon that's talking about parenting in the times of COVID-19. It was developed with some colleagues in other places, including UNICEF, and it talks about sort of positive parenting approaches, because we know that families are under huge stress. Someone referenced this at the beginning of the call. You know, many people are trying to do their job while also providing childcare, and then we have people that don't have childcare but need to be working in hospitals, and there's so many different scenarios. And so part of what we're doing is doing that type of communication work, putting resources out. There's hotlines that are listed on the website, so that's all kind of for the general public. The other thing that we are doing is that we're creating a sort of longer term social behavioral strategic plan, for lack of a better word. And I actually just emailed you, Michael. We would love to get input on as we're creating this plan, because there are so many different considerations to look at. We're bringing other people into our team, including people that focus on intimate partner violence, people that focus on suicide, people that focus on sort of other things in that context that are really showing up as we see more and more people that are unemployed, people that are displaced, and things like that. So I think more to come, but if you all have ideas, I think either feed them in through your MCHB channels or your MCHB channels, or send them to us, and we are really interested in hearing what the biggest issues are and then trying to respond to those. Thanks.
Great, thank you. There are a couple of questions here. I will just quickly say that one of the things that we're doing at MCHB is we put together an internal COVID team to field some of the questions that we're getting from our members. We'll share out more information around that to the folks on this call and to our membership. So if you're getting questions, if you have questions, we have a way to field those and then take it to the appropriate resource to get feedback for you. So more to come on that. As I'm looking at the chat function here, there are a bunch of questions coming through. One from Hawaii. Any guidance on how you want states to integrate COVID into the assessment report? I believe that's for you, Dr. Warren.
I assume, which is always dangerous, but I'm assuming they're talking about the needs assessment. But I'll speak broadly for the block grant application and report. I think, states always have the flexibility to describe what they think is important for MCH populations. So if there's a way to work that in the needs assessment, that is absolutely okay. Remember, there's also the opportunity. Needs assessment is not just every 5 years, it's ongoing. And so during the interim years, You'll also have the opportunity to talk about the COVID response and the impact on MCH populations. In your application and report part of your block grant, you're reporting on the fiscal year that has already ended. But in your application part, where you're talking about planned activities for the coming year, you may very well want to mention COVID there. Again, it's up to states. We always give states the flexibility in what you want to include there. I would say a couple of things. If you have questions, always feel free to reach out to your project officer. They can give you guidance there. And then there will always be next year, and you will have the opportunity to continue to update or provide new information. And so if there are things you want to put in this year but don't have the opportunity, you'd be able to do that next year as well.
Thank you. Going down the list, and Brandon Moline, I may ask you to come off of mute and clarify if I misstate your question. But reading here in the box, it says, does anybody have any updates on the first rounds of assistance in regard to support for local and state health departments? When, how is that money being disseminated? And will it be dispersed on a per capita funding mechanism? Or how might we estimate any support we might be getting?
This is Amy. I can say I know in terms of some of the support that's being distributed through the new funding, that there's a minimum of how much each state gets, and then the rest of it's by population. I'm wondering, I know we have some folks from ASTO, sorry to put them on the spot. I'm not sure if they have done this analysis yet or not, or if our folks at CDC might know. If not, we will definitely, we're keeping track of all the questions, and we'll make sure to get back to everyone.
Thank you, Amy. Just allowing a few seconds if anyone from ASTO or others want to chime in on that. If not, as Amy mentioned, we're collecting these, and we'll make a point to get a response out as best we can to follow up offline. We have a question here regarding from Kay regarding how we optimize Title V flexibility. Temporary hiring of more public health nurses, community health workers, doulas, and others in MCH-related roles that may not be supported by Medicaid. Things like temporary hiring or reassignment of MCH public health workforce to be the front line for MCH population calling in, professionals to do screening, triage, and advice via telehealth desperately needed. Augmenting capacity of local public health and private nonprofit agencies to serve families virtually. Pregnant women, new moms and babies, children, youth with special health care needs, etc. Continuing and augmenting funding for virtual school health services, monitoring what is happening to MCH populations. So I think this question, Dr. Warren, is more around just flexible funding and recommendations around Title V, use of Title V funds to address the COVID need.
Thank you, Jonathan. You know, I think this is one of the strengths we often talk about with Title V funding, that it really allows states and jurisdictions to meet the needs of their MCH population. And as you all know very well, there are relatively few strings with your block grants. There's the 30-30-10 rule is the big one. 30% on primary and preventive care services for children, 30% on children with special health care needs. Those are minimums. And then no more than 10% on administrative activities. So there is already a lot of flexibility baked into the block grant. And as always, the way that you prioritize, the way your state approaches your action plan and your expenditures are up to you, provided that you abide by those 30-30-10 restrictions. Again, I would say if there are questions that you have specifically about that, please feel free to reach out to us and your project officer. But I have, in the face of all this uncertainty, have such great hope that you all are on the front lines of responding to this, because you are so masterful at thinking creatively every day about how to be flexible to meet the needs of your populations. You do this already. Granted, this is an unprecedented challenge that we're looking at, but think about how you already stretch those flexibilities and how you work within the Title V framework. And I think you'll be well poised to do that. Again, if there's something that doesn't seem to fit or you've got specific questions, please reach out to us. But we're fortunate that Title V is so flexible, particularly in times like these.
Thank you. And we appreciate that flexibility as well. I'm going to jump around a little bit on the questions here just to make sure we have a good balance of questions and responses. And I'll do my best effort not to miss any things that have come through. But I want to go back to you, Dr. Peacock. There's a question here about is the task force working on guidance for standing up quarantine sites for the well and the sick MCH population? These quarantine sites would be areas outside of their home or house. This comes from Jenny Bissell. So I don't know if you're offering any guidance on how to stand up those sites.
And just a reminder for our folks from CDC, I think that question was more specific to Dr. Peacock, perhaps to unmute your line if you can answer.
Or Dr. Belong, did we lose you guys?
I'm so sorry, I lost connectivity there for a second. Can you please repeat the question?
Yeah, it was, is the task force working on guidance for standing up quarantine sites for the well and the sick MCH populations? And it specifies these quarantine sites would be areas outside of their home or house.
I see. I'm not aware of those specific types of effort. Go ahead.
No, you go ahead. That's fine.
Oh, okay. Hi, this is Dr. Milan. I'm not aware of specific plans for guidance on establishing quarantine sites per se. Most of the work that we do takes a look at infection prevention control guidance as it applies to how you group certain types of people together, depending upon whether they have confirmed infection, if we suspect infection but don't have a test back yet, and then from those who are healthy. This would probably be a question that's more set for one of our health systems teams, and I'm happy to take that question back to them.
Thank you very much. A question for you, Dr. Warren, and the folks at the MCHB. What about the expectations around the MCH block grant application public comment period in each state? Have these expectations changed?
Thank you. It looks like that question came from Lonnie Burnett. Thank you for that. The guidance is not changing. The guidance that we're working under is the one that was already published. Again, I would go back to what I repeated several times, and it bears repeating. So I appreciate you asking the question so we can share it again. We ask that you do your best and submit what you reasonably can for all the components of the application and the report and the needs assessment.
Thank you. Jumping back to our friends at the CDC, any specific guidance on COVID-19 and at-risk children with special health care needs?
Hi, this is Georgina. So we have not created any specific guidance for children with special health care needs. We do have some information that is being put together for related to people with disabilities, and then you know, we would be opening to hearing from the community if there is something specific that's needed related to children with special health care needs. Fortunately, we have not been seeing a lot of severe illness in children, and we continue to not see a lot of severe illness. We are continuing to monitor that, and certainly, you know, I think we all, meaning we as a collective, are concerned that maybe children with medically complex conditions or children with disabilities may be at higher risk, but we have not seen that play out. The other issue that we have been hearing about is concerns about maybe providers that come into the home, or other allied health professionals or direct support providers that work with children and adults with disabilities, and there is some guidance that will be coming out that addresses that specifically. But if there are other needs or there are other questions that are out there, please let us know. The other thing that I think was just recently released is some information about childcare. So FAQs on childcare in this context and how childcares can stay open safely. And so that's another resource maybe we can provide to MCHB that they can get out to you all.
Thank you, Dr. Peacock. Just a quick follow-up that came through, just something that you may want to flag just to keep this part of the conversation going a little bit. But one of the attendees, Deirdre here, flagged that families of children with special healthcare needs are concerned or worried about who will take care of their child if the parent or caregiver becomes ill. So that just may be something as we're mining for needs and concerns. That seems to be one that exists as well to keep in the back of your mind.
Okay, thank you.
Jumping back to the Bureau, will OMB clearance review of block grant guidance and forms also be delayed?
So thank you. That question is referring to the process that we're undergoing right now as we look at the next round of guidance for the block grant. So it doesn't apply to what you're submitting now this summer in September, but it would rather be starting in the next year. We don't have any indication yet that that's going to be delayed. One of the things we're trying to balance in the Bureau is our immediate response to COVID, and then to the extent possible, keep all of the regular work going. And part of that regular work is the update to the guidance. So as of right now, we don't have any indication that that will be delayed, but we will certainly keep you all posted.
Thank you. And one more for you, Dr. Warren. From Michigan, we are uncertain of full impact of COVID-19 on our programs and local health departments' ability to expend on or carry out programs that currently count toward our 30% children requirement. How should we address this?
So I think as you have questions, specific questions like that, if you'll start with your project officer, that's the best place to start with that. The earlier you can reach out to them, the better, but let them know those concerns you're having and they'll be happy to talk with you and explore how best to approach that.
Great, thank you. Maybe we have time for these two very quickly. Can we also redirect PHS Act funding? The guidance letter talked about FTEs under these programs. What about those programs?
I can start there. I think CDC certainly may want to weigh in as well. We issued some guidance early on. So in the Bureau, in addition to programs that are funded under Title V, which is largely the block grant, we have programs funded under the Public Health Service Act. And so in communications that have gone out as Title V programs, we talk about a provision there around temporary reassignment of personnel. And so those provisions are known and are stated there. I think if you have other questions about the way you approach your budget and your work plan, I would encourage you to reach out to your project officer and explore with that particular program what flexibilities there may be.
And then the question here for you, Amy, as you're leading up our government affairs piece, and I'll jump in on this too after you go. But during the Zika outbreak, MCHB submitted funding requests to Congress for a Zika congressional caucus. Was that done for COVID-19 for the at-risk MCH population?
Okay, so thanks, Jenny. I'm not sure what you mean by the Zika congressional caucus, or do you just mean to Congress in general for extra funding to address Zika? But we have been actively involved thus far in supporting both either just like in conversations with members of Congress individually who ask us or that we have relationships with that we've reached out to share what some concerns are for the MCH population. We've also signed on a lot of letters or helped draft letters that have been signed on by numerous organizations, and we're actually talking more now with colleagues. So like MCHB is a perfect example of that, where there's some flexibilities that would be, would be helpful for the MCHB population. I would love to hear from any and all of you. You can contact me directly if there are things that you need, and we can sort of speak, not on this webinar, but so we can make sure that those messages are being conveyed. I think that would be really helpful for us. We want to make sure that we're able to communicate what the real needs are on the ground.
Thank you, Amy. Quick question for the CDC and the Bureau. I know it's a little bit of a weighted question, but I know on behalf of our membership, since this has been a pain point, the relaxation of the rolling deadline or relaxation of the deadlines from a reporting perspective is extremely helpful as people are looking to allocate resources to the COVID response. I think having that removed if necessary, that weight or burden removed if necessary is helpful. Do you know of any coordinated efforts across federal agencies within HHS that are also looking at these types of adjustments, since our folks on the phone may be pulling from CDC funding, maybe pulling from HRSA funding, MCHB funding, SAMHSA funding? Do you know of any coordinated conversations or efforts to help with that across the board?
I can speak for HRSA. I would say, we all are connected to OMB, the Office of Management and Budget, and OMB has released some guidance for agencies. And then my understanding is then each agency is approaching that flexibility as they are able. So I would defer to each individual agency, and so again would encourage folks to connect back with their project officers to understand how their individual agencies are approaching it. I mentioned earlier our flexibilities around the block grant reporting deadlines and the MCV non-competing continuations. If there are other questions, certainly feel free to reach out and let us know. Thank you.
As we are approaching our time here, I want to be respectful of everyone's time on the call, but this has been a great conversation, and really want to again thank the folks on the call who are on the front lines of this response. My thoughts and prayers are with you on a daily basis. The sacrifices you're making to make sure we're all safe and healthy cannot be understated. So really appreciate your passion, energy, and commitment to this work and to those that you serve. I also did want to take the time to thank our MCHB and CDC leaders for your tireless efforts in leading us through this work and being responsive and willing during all this to come onto this call and commit to coming on this call on a regular basis to hear from our members and also provide the insight that you have. Our commitment as MCHB is to take the comments that we've heard, the questions that we continue to hear, and have the appropriate level of conversations with our federal agency partners or other resources to see if we can get things moved forward for our members. So we'll take what we have here that we're getting in the chat box, and we'll do our best to communicate back to all of you progress across the board. As I mentioned, MCHB is standing up an internal COVID team to help to field some of these responses and then respond appropriately. And this call is happening every 2 weeks. We'll send out another notice to folks, and we will continue to invite our HRSA MCHB leadership and our CDC leadership as their time and schedules permit. If there are any other questions or comments, please feel free to put them into the chat box. But again, thank you all for your time, effort, and energy, and your response as we move through this COVID-19 normal. And we look to get back to normal hopefully soon. So thank you all. We're here for you, and I really appreciate your work in this.
Thanks. And before you all go, thank you again for participating. You'll get a registration link both in the chat that Jess Cohen added, as well as in the slides. We'll be doing this again in 2 weeks. We will work with our federal partners to see if they can help participate as well. We're also going to have a survey that pops up. So in addition to recording all of the questions and comments that were typed during this chat itself, we will take everything that you add in this survey. It's 2 questions. And one is just completely open-ended about if there's any questions or concerns you have. So we will take all of that, and we will either, if it's, MCHB that can respond, we will respond. We will also share that with our partners at MCHB and CDC. So thank you.
Thank you all.